Thank you for joining the Missouri Cancer Registry Town Hall. My name is Lucinda Ham, and I'm the Operations and Quality Assurance Manager for the Missouri Cancer Registry and Research Center. I would like to acknowledge that Missouri Cancer Registry and Research Center is housed on the campus of the University of Missouri in Columbia, Missouri. The Missouri Cancer Registry and Research Center is supported in part by a cooperative agreement between the Centers for Disease Control and Prevention, the CDC, and the Missouri Department of Health and Senior Services, DHSS, and a surveillance contract between DHSS and the University of Missouri. Missouri is also a research state for SEER. Next, we will review federal legislation and the Missouri state regulation. The links to the federal legislation and state regulation can be found on our homepage at cancerregistry.missouri.edu. The federal regulation became effective on August 28, 1999. The original Cancer Registries Amendment Act was initiated in 1992. The types of facilities that are required to report are listed in the legislation. All types of cancers, including benign brain cancers, are required to be reported with the exception of skin, squamous cell, and skin basal cell carcinomas. Missouri State Regulation. This is a snip of a small portion of the Missouri State Regulation. The purpose of the state regulation is to establish a method of mandatory reporting of all cancer cases of inpatients and outpatients in order to conduct cancer incidence surveillance and epidemiologic studies, and to facilitate development, implementation, and evaluation of cancer prevention and control measures in Missouri as required by federal regulations. Currently, non-reporters are not penalized for lack of reporting. However, non-reporters will be placed on a remediation plan, and MCR will work closely with you and your administrator until your facility complies. National Program of Cancer Registries. Here are the NPCR standards for cancer data collection. Standard 1.3. Ensure that the registry collects all reportable data in accordance with NPCR requirements. Central cancer registries must collect and submit data for all reportable cancers and benign neoplasms, including, at minimum, primary site, histology, behavior, date of diagnosis, race, ethnicity, age at diagnosis, sex, stage at diagnosis, and first course treatment according to CDC specifications and other minimum information required by the CDC. Standard 1.4. Use and promote electronic reporting among facilities and data sources. For hospitals reporting to the Central Registry, increase the percentage reporting electronically every year to meet the standard of all hospitals reporting electronically by the end of the 5-year performance period. All hospitals will be required to report electronically by the end of 2027. Facilities may use the WebPlus software program with a limited display to make the reporting as easy as possible. Why do we need your cancer cases? Being a surveillance state, we need your cases to identify cancer patterns and risks in various populations. We need your data to identify potential environmental exposures relating to cancer. Knowing trends and identifying patterns and risks in populations allows communities, state, and national leaders to make informed decisions about the need for cancer screening, prevention, diagnosis, treatment, and survivorship in a particular area. Over the past year, MCR has worked closely with Missourians affected by the radiation exposure in the St. Louis area. Many would not have been eligible for compensation by the Radiation Exposure Compensation Act at the Department of Justice if their case had not been reported to MCR. Many hospitals do not maintain medical records past 20 years. Cancer inquiries are reports of possible excess cancer in a particular area. These inquiries are investigated by the Department of Health and Senior Services. Lastly, data reported to MCR is used for researchers who find better ways to detect,
treat, and prevent cancer to improve the lives of Missourians and decrease cancer mortality.
MCR data flow. As shown in the pictogram, MCR receives cases from many types of reporters. MCR receives over 80,000 abstracts annually. The MCR QA staff consolidates the information to create a high-quality abstract that can be submitted to the NPCR and NACER annually during the annual call for data. Data reporting. Cancer cases can be abstracted in WebPlus. Larger facilities use the MO hospital display for abstracting directly into WebPlus. The MCR team created a MO LV hospital display to assist with this process for smaller facilities. We realize there's a learning curve to completing the fields accurately and correctly. Release the case when it's complete and passes all edits. The MCR team will gladly review cases before being released and provide feedback to new abstractors. This is part of the one-on-one training for new reporters. MCR exports all abstracts from WebPlus for each facility twice per month. Again, do not report squamous cell or basal cell skin cancers. Text fields are required. The MCR team uses the information in the text fields to ensure the data entered in the fields is correct. Text fields are also used in case consolidation and other QA activities. Timeliness and completeness. WebPlus abstractors are monitored for timeliness and completeness. Facilities are sent quarterly status letters. Cases should be abstracted and released within 6 months of diagnosis. Facility volumes vary. Caseload is determined by an average number of cases reported in the past 4 to 5 years. Quality. Quality assurance in cancer data involves carefully reviewing case abstracts, verifying source documentation, and ensuring every element such as primary site, histology, staging, and treatment is coded accurately and consistently. High-quality cancer data is essential as it directly influences national cancer statistics, research outcomes, and public health initiatives. It drives improvement in case care and strengthens the evidence used to guide prevention and treatment strategies for generations to come. NPCR requires MCR to audit facilities at least once in every 5-year grant cycle. We have a smooth audit process which allows us to audit a facility in a short amount of time. Cases not meeting quality and completeness standards are corrected and reporters are notified. In rare situations, the cases are sent back to the reporter to be redone. Edits. So what are edits? Edits are a standardized tool that promotes cancer registry data quality. Edits enforce consistent coding across multiple related data items. Every case must have the edits cleared prior to releasing. Use references such as the SEER solid tumor rules and the STORE manual to help troubleshoot those errors. The MCR Abstract Code Manual is also an additional resource. Death clearance. MCR performs linkages with the Missouri Department of Health and Senior Services to identify patients that have passed away. Cases are updated with the date of death. Missed cases are those that have not been received by the registry. Missed cases are sent to facilities for information. Death clearance follow-back requests may appear in your facility list. These cases require review and response. Education. This is a summary list of educational opportunities a new abstractor can view or listen to. Show Me tips are produced quarterly by our education coordinator. NACER webinars are posted monthly to our website. Our YouTube channel contains a variety of short how-to videos on various abstracting topics. The MCR course catalog contains the Fundamentals of Abstracting course and the Missouri Oncology Data Specialist Study Guide course and several others. As always, we are willing to provide one-on-one training via Zoom or Teams. Visit our website at https://cancerregistry.missouri.edu. MCR website and resources. Again, abstracting resources are readily available on our website. Abstracting resources can be found in the Reporting tab on the MCR website. The main abstracting resources include the MCR Abstract Code Manual, the Store Manual, SEER Solid Tumor Rules, and the ICD-10 Reportable List. The SEER website also includes the Hemi-Lymph database and interactive drug database. The Education tab contains links to the NACER webinars, YouTube videos, and Canvas courses. The WebPlus login page includes the WebPlus user manual, a WebPlus overview PowerPoint, a WebPlus contact user form, and information about uploading files to MCR. Cancer data. Cancer data is used in many ways. Every case counts. If your facility is the only hospital in the county, the lack of reporting cases does not show the true picture of cancer activity in your area. Again, the MCR team is happy to work with you and provide additional one-on-one training. We provide feedback on cases reported, and we are willing to work with your administration if you need that kind of support. On our website under Missouri Cancer Dashboards, you will find Cancer in Focus Maps, Cancer in Focus Hotspots Maps, Missouri Health Maps, a link to MICA, which is the Missouri Department of Health and Senior Services program, and a dashboard showing young adult cancers in the state of Missouri. Lastly, I included a link for the U.S. cancer statistics. At this time, I would like to answer any questions you may have about cancer case reporting. Thank you for attending the Missouri Cancer Registry Town Hall today. I can be reached at lahfip@health.missouri.edu or at 573-882-0379. Thank you. Bye-bye.